Good evening, everybody. Welcome back to Bread and Butter Primary Care with Dr. Stokes. Today we're going to be continuing on our diabetes section, talking about diabetes important history elements. Now, the way I'm organizing the videos, my vision is that eventually there'll be playlists for every disease process. So a playlist for blood pressure, and one for diabetes, and one for thyroid, and one for everything else. And I want to have each one be similar, and so there'll be history elements for diabetes, and a history elements for hypertension, and a history elements for this. And so today is going to be diabetes important history elements, the things that you may find on a history in a patient that would make you think, hey, maybe this is diabetes, I should check. A lot of this information is going to be very similar to the video I already did on diabetes, what is it doing to me. That's more of a patient-focused video for patients about what is happening to their bodies when they have diabetes, whereas this is more from the perspective of a medical student or a PA student or a nurse practitioner student or whatever the case may be, when you're first gathering histories and trying to figure out what are things that would make me think diabetes. The information is very similar, so if you've seen that other video, you'll notice it's the same information, just kind of for completeness sake, a different approach. And so the first thing I would say, as far as when you diagnose someone with diabetes, the most consistent or the most common history element is actually nothing. So most diabetes, especially type 2 diabetes, is diagnosed asymptomatically. People will have high sugar levels. Their bodies won't be processing sugar the way it's supposed to for a long time before people start to feel things changing. And so, for better or for worse, in primary care, we tend to be a little bit lab heavy, meaning that most people who see a primary care doctor end up getting some sort of blood work done. And so we're finding diabetes earlier and earlier. So the most common way that I come across someone with diabetes is actually someone who's coming in for their first visit and wanting to establish care. And oftentimes they'll be like, I want to be checked. I want to be checked for diabetes. I want to be checked for blood pressure. I want to be checked for anything you can check me for. And then that goes a little bit into the video on screening for diabetes and when to screen and who to screen for. So we won't cover that right now, but most commonly diabetes is something that's diagnosed without any symptoms. But as the disease process progresses and as you get further into it, there are some things that start to happen that people might complain of that would cue you into the fact that maybe they have diabetes. The three most common are what I like to call the excessives. So excessive thirst, excessive hunger, and excessive urination. So when you have diabetes, sugar in the blood is at an elevated level, which means the kidneys can't handle all of it. And so they end up spilling sugar into the urine. All that sugar into the blood pushes fluid out of the vessels and through the kidneys into the urine, and so you actually form more urine when you have diabetes. Now that's a bad thing because what it's doing is dehydrating the person, but that's why they have excessive amounts of thirst and they urinate a lot. So if you have people coming in and saying, I just notice I pee a lot more than other people and I'm just constantly thirsty, then that's a reason to think, well, maybe this is a diabetes problem. Excessive hunger can also happen because of high insulin levels. When people who have type 2 diabetes, their insulin doesn't work right, so they overproduce. They have a lot of insulin, which then drives hunger. So oftentimes people will be eating a lot, they'll be drinking a lot, and they'll be urinating a lot. So those are three common history elements to watch out for to make you think this might be diabetes. Another thing is transient blurred vision. So if people are coming in and they're saying, my eyesight is usually fine, it's usually good to go, but I'll have days where I have just horribly blurred vision, and it'll be blurry for a while, and then the next day it's back to normal again, and I have these bad days with blurred vision. That's enough to make you think, well, maybe this is diabetes. If the sugar is getting up to really high levels, then the body starts to deposit a form of sugar called sorbitol in the eyes, and so you can get blurry vision. But as the sugar levels come down, because of a period of fasting overnight, whatever the case may be, then that blurred vision actually resolves. So transient blurred vision where it comes and goes would make you think about diabetes. So we got the excessives, blurred vision, and then just generalized malaise, just not feeling well. this is probably one of the most common complaints you'll get as a primary care doctor is, I just don't feel good. I'm tired. I don't have any energy. I'm run down. Diabetes can do that because you're urinating a lot, you're dehydrated, and so it is a taxing process for the body to go through. So that's another thing to think about. One other one I'll mention, as far as just interesting history elements for diabetes, is frequent yeast infections. Okay, and we're talking about like skin dermatitis, but in the genital area. So if you have both women or men, but especially men, who are coming in with yeast genital infections, where the skin around the genitals is red and macerated, and you've got satellite lesions, and it's itchy and irritating, and they say, I went to an urgent care and they told me it was a yeast infection. They gave me this cream, it went away, and now it came back again. That's definitely a sign that maybe they have diabetes because their sugars are high, they're leaking sugar in the urine. That sweet, sugary urine is on the skin in the genital area, and it allows yeast to prosper and to grow. A few months ago, I was covering an urgent care, and I had a guy come in with exactly this. He had these constant infections and problems, and I got a urine sample as he went into the room. Before I went in to talk to him, the urine was completely normal, except the sugar was extremely high. And so I was able to walk in and say, look, you have a yeast infection, and it's because you have diabetes. He had not been diagnosed yet, and so we talked about both of those things and got him started on some treatment. So remember the excessives: excessive thirst, excessive hunger, excessive urination. I guess we could put excessive yeast infections in there as well, and then excessive fatigue. Those are things that will make you think, hey, maybe this person has diabetes. Transient blurred vision as well. So when you're getting those histories, you have those things come up. They're kind of vague symptoms. Those symptoms can be a part of a lot of different conditions, but diabetes is something to think about. And again, the most common reason diabetes is diagnosed is actually because of asymptomatic testing, screening that's just done, and you get a high sugar or high A1C, and so you start down that path. I hope that's helpful for you as you're collecting histories, as far as what history is helpful when diagnosing someone with type 2 or even type 1 diabetes for that matter. Have a great night.